You are among my favorite people. You are
Oh,
among my favorite physicians. You are among my favorite go-to people about what really works and helps as opposed to what is coming and going like the clouds. So, Ellie Campbell, thank you for joining us and thank you for being here.
oh, thank you, Dr. Jaffe. You're one of my favorite people. I feel like, in integrative medicine, there's the shoulders of giants that we stand on. And I feel like you are one of those. You are connected to everybody who's anybody in the integrative medicine world. If you don't know them personally, you're less than 1 degree of separation and can get me any information that I need about any health topic anytime. And I'm so grateful for your mentorship and your experience, wisdom, and knowledge.
Thanks so much. I have been around a while,
You have
and
a little bit.
yes, I too have stood on the shoulders of giants and therefore been able to see a little bit further. And I am very eager for you and others to see even further than I, but building upon what we have learned about the importance of alkalinity, what we have learned about the importance of inflammation, what we have learned about the unimportance of cholesterol if it is not damaged. So
Right.
please tell us about some of these things.
Yes, I'd be happy to. So this is February. This is American Heart Health Month. And so the emphasis for this month is for us to teach and learn about cardiovascular disease. And it is my now well-informed opinion that heart attacks are optional and strokes are stoppable. And cardiovascular disease does not deserve to be the #1 killer in our country because it's a lifestyle problem. And we have allowed fake frankenfoods to end up on our plates, and we have allowed too much stress and oxidative influences to be in our world, and we don't have to tolerate that, and we can make changes that are meaningful and not that difficult, because if you're willing to get the right tests and do the hard work, we can identify if you are at risk. People often feel like there's kind of two groups of people who feel that they are doomed to a cardiovascular event because their father, their uncle, and their brother all had heart attacks, so they're just waiting for theirs to happen. And that's certainly not true. Maybe 20% of your risk is dependent on your genes, but 80% is your lifestyle. And using advanced lipid testing and markers of oxidative stress and inflammation, even those people can be identified. And now we have genetic tests that help us maybe tweak your diet, maybe tweak your supplements, maybe even give you a prescription drug in some cases to help to mitigate those genetic risks. But that's the small percentage. The majority of us, we just need to learn how to eat better, drink better, sleep better, think better. And when we do those things, our risks are dramatically reduced.
Eat,
So,
drink, eat, drink, think, do.
yeah,
That's a prescription for life.
yeah. Maybe we could put pray in there too, but I think that
Uh,
we have.
let me jump in on that. As you know, I am a man of science and medicine, but I'm also a man of spirit and wisdom. And I've been cross trained in part by people who are wise, compassionate, kind, considerate, but they wanted me to show up and do the work. And as you correctly say, information is a start. Inspiration is important, but what you perspire to do, what you actually function to do, is most important.
Right, absolutely. And it's hard. One of my mentors once said that it's easier to change somebody's religion than it is to change their diet. And so there's some truth to that. I mean, we come to have social norms and the family customs of the ways that we eat. But unfortunately, if your mother gave you Twinkies for breakfast and canned soup for lunch, and this is what you want to pass on to your children, that's a recipe for a premature cardiovascular event. So we want to find alternatives that have just as much love in the food without toxins and toxicants. So um, I think, when I practiced really conventional medicine for 13 years. And while I did that, I learned that I wrote a lot of prescriptions and I didn't make people very much better. And so I'm a DO by training, and osteopathic physicians are trained in body, mind, and spirit. And I felt like I lost the body part, the mind part, and the spirit part as I became a conventional doctor. And so I embarked on a personal journey to try to get back to my roots. And part of that was driven by my daughter, who developed bleeding eczema on her hands and migraine headaches at the
Mm,
age of 7.
mm,
And her conventional doctors didn't have any treatments. But when I took her to a non-conventional integrative practitioner who did some very woo-woo energetic testing and said, your daughter is severely sensitive to gluten, dairy, eggs, soy, and corn. Get those out of her diet. And by the way, she's nutrient deficient in B vitamins and vitamin D and vitamin C, and her skin won't repair if she doesn't have those vitamins. And so we got her started on vitamins. No doctor conventionally had ever talked to me about vitamins after the prenatal period. And so that's what we did. We changed our diet radically. It was hard at first. I mean, a little kid, a 7-year-old, can't go to a birthday party and eat any of the stuff that the other kids eat. We had to make stuff and bring it with us. But her eczema went away and her migraines went away and she healed and she's a perfectly healthy, normal graduate student now. And so that journey shifted my thinking, and I started using more and more integrative medicine strategies and started going to integrative conferences. And that's where I met you, at an integrative medicine conference through the International College of Integrative Medicine. And that's what shifted my paradigm. And that's what changed my thinking about, we've got to get to the root cause. And so I decided to write a book about therapeutic lifestyle changes, the top 10 things that you need to do to make your life better. Eat clean food and drink clean water and exercise and pray and meditate and be in gratitude and spend time in nature and all these things. And I wrote a book and it was really boring. And it felt like I was trying to shove information down your throat. And I pitched it to 86 publishers and nobody wanted it. So instead, I decided that I was going to ask my friends and patients what they wanted to learn about. And I went on Google and I looked to see what the top 10 health searches were. This was a little before COVID hit, because COVID overtook everything. But in the top 10, in 10 years, in the top 10 health searches, people wanted to know about blood pressure. They wanted to know how to understand their blood pressure. So I had an epiphany and I said, all right, I'm going to write a Trojan horse. I'm going to write a book about blood pressure, but then I'm going to teach them all the 10 things that they need to know. And I'm going to include the thing that I'm truly passionate about, which is the number one hidden risk factor for the number one killer in our country. And that number one factor is oral health. If we don't have a healthy mouth, we can't have a healthy heart. If we don't have a healthy mouth, we can't have healthy blood vessels. If we don't have a healthy mouth, we can't have a healthy gut. If we don't have a healthy mouth, we can't have a healthy brain. So as I started studying and going to more and more integrative dental conferences, I began to connect the dots between medicine and dentistry. And now this has been the last 3 or 4 years of my life has been spent teaching dentists that they play a role in helping me keep my patients from having a heart attack. Because no cardiovascular prevention program is complete without a medical doctor, a dentist, and a hygienist on the team. It really
And,
does take a team effort.
and we have added LRA dental testing, taken over from the Clifford method and improving it to include T cells and functional cellular responses to provide personalized care about a healthy mouth.
Yeah, because sometimes bad things happen to our teeth. Sometimes there's a trauma or a cavity from a previous bad lifestyle, too many acid foods, too many sugar and starch foods stuck on your teeth, mouth bacteria grow there, make acid, eat the enamel, and you end up with a cavity. Cavity extends, you end up needing a root canal. The root canal needs to be is good for a while and then goes bad, and then you need that tooth extracted. Now we have to do an implant. How do I choose an implant that's safe for you? Because what's safe for you might not be safe for me.
Right.
And this is where LRA testing is life-changing for patients, because the worst thing that you want to do is spend all that money on an implant just to have it extracted down the road because it was incompatible.
Right.
Furthermore, there are mouth bacteria that live in our mouth. We need them. They're friendly commensals, just like we need to have friendly commensal microbiome in our gut. We need to have it in our mouth. But if they become overtaken by pathogens, the pathogens can lead to low-grade inflammation that prevents that implant from taking hold. And so you should never do cosmetic dentistry or implant dentistry until you've had a salivary diagnostic test and spit in a cup and make sure you don't have those inflammatory pathogenic mouth bacteria that lead to too much inflammation and prevent that dental work from doing its job, from holding.
We've been invited to contribute a few chapters on wound healing to a dental textbook for dentists on green dentistry, on true health promotion and understanding inflammation as repair deficit. If I may, can I send you a preprint of those chapters for your comment and critique?
Yes, absolutely. I would love to. That would be my honor. I would be so interested to read that and get educated on what I don't know, because I want my patients to have the best possible outcomes whenever they have a dental problem. And so, knowing what I know now, we've been able to use that dental information. I have blood work that I can do in my cardiovascular evaluation that clues me in that they have a dental problem. For example, there's two tests that are commonly done by Cleveland Heart and Boston Heart Labs. One's called myeloperoxidase, and the other one is called LPPLA2, and that stands for lipoprotein-associated phospholipase A2. It's an enzyme. Both of these are made by white blood cells. They're made by white blood cells inside the artery wall when an artery becomes inflamed. And they are predictor markers that tell us that you're on the path heading towards a cardiovascular event. Sometimes those events are very minor. There's a little blip, a little rupture of the plaque, a little cholesterol and goo leaks out into the artery wall, and a body makes a blood clot over the top of it and seals it off. It's completely asymptomatic. The only way you know it happened was when you do an ultrasound and see plaque in the artery at a later date. But sometimes they're profoundly symptomatic. They occlude the entire vessel. You have a sudden event of a heart attack or stroke. Well, I have leading indicators that tell me you're at risk for that, LPPLA2 and myeloperoxidase. When I see those, we got to step it up a notch. We got to get you to the dentist, or we got to get you on more antioxidants or more anti-inflammatories, or change your supplements or add a drug or do something. But
one of the presidents of the American Heart Association, whose name was Förster, who wrote a whole book on the vulnerable plaque, which is what you have elegantly described, is on our wavelength.
Excellent. So this was the revelation to me. Myeloperoxidase is also seen in gum tissue. And the deeper the inflammation, the higher the myeloperoxidase level in the gum and in the bloodstream. When I see a myeloperoxidase elevation now, that patient goes straight to the dentist to get a cone beam CAT scan to look for a hidden dental abscess, often in a root canal tooth. That tooth has no nerve. It doesn't feel the abscess brewing, but I can see indications of it in their blood work. So
and
now,
as an option to avoid implants, you can use nylon appliances that you put in and take out, but no implant.
yes, and that might be an option as well.
An option, right.
Yeah, and so we want people to know that there's options, right? There's not always only one choice. And LPPLA2 is commonly seen in periodontal disease,
Yes.
in gum disease. So when a patient has elevated LPPLA2, it's my job to decide if that inflammation's in their arteries, and it's the dentist's job to decide if it's in their gums. So we have to work together. And I need my dentist to be educated in the vocabulary so that when I send a patient who's very well educated and says, "Hello, Miss Dentist, I'm here today for my cleaning. And by the way, I have elevated LPPLA2," the dentist immediately knows that they need to take a much more careful tooth edge analysis of the gum tissue and the depth of that probe to be sure that there's not any inflammation. And sometimes there's no bleeding on probing. There's no pocket depth deeper than 4 millimeters, but we do a spit test and lo and behold, those mouth bacteria are there that are driving the inflammation. So it's a team effort, and it takes the team, but it takes an educated team. And so I'm thrilled that this chapter of my life is dedicated now to teaching dental professionals how to communicate with medical doctors and medical doctors how to communicate with dentists.
Now, tell us the title of your book, and if you can even show it to us.
I have it right here.
The
It's called The
Blood
Blood Pressure
Pressure
Blueprint. It's
by Ellie Campbell.
The holistic guide to defeating hypertension. And the
Wow.
subtitle is what I truly believe, which is heart attacks are optional, strokes are stoppable, and dialysis is not your destiny. And all three things are connected, right? What does a heart attack and a stroke and kidney disease have in common? Blood vessels, right? It's the atherosclerotic plaque, the hardening of the arteries, and the inflammation in those arteries that leads to the organ dysfunction. And so when we have leading indicators in our blood work and nutritional markers that help us decide if the patient is nutritionally deficient or too acidic and not alkaline enough, we work on correcting all of those things, and we can make a huge difference. And in my experience, the number one driver of the alkalinity is not getting deep restorative sleep. We're spending time mouth breathing, and we're not getting our quiet, deep, heavy sleep that normalizes our pH. So we need to do a sleep test and identify, because CPAP is not the only treatment for sleep apnea. And many of my patients refused to get sleep testing because they're like, I could never wear a mask. I would suffocate. It would be terrible. Guess what? I got 5 other things I can do for sleep apnea that are not CPAP. And so there's never just one thing. We always can make a difference in your sleep quality and duration, usually without drugs.
Well, people are fortunate that there are physicians like you. You're in the Atlanta area. You have a regional, if not national, reach and practice. You help train dentists and physicians in these more restorative approaches. So thank you for being you. Thank you for writing the book, and all success both in practice and in your teaching.
Thank you, my friend. Wow. Without mentors like you, I would not be capable of doing what I do. So thank you for your mentorship. It's an honor to be in your tribe.
Most welcome.